Controlled medications. I'm on the provider side of things and have come to understand the pharmacy concern that 28 days may lead to 13 prescriptions per year. I prepare patients on 30-day months to get their refill on the prior month's date -1 and on 31-day months -2. I try and write an explanation on the ERX notes if the patient has a vacation or other reason things don't perfectly match and pre-plan as much as possible. We are all in this messed up disaster system together. 28 typically, could be 27 or 29 depending on when patient requests and what insurance allows. Generally, we follow insurance and regulatory together. Since our state allows 27, we allow as early as 27 but yield to insurance if they're more strict. Even as a tech who takes a controlled med, I can't imagine the stress of a 30-day, zero buffer window. Way too many moving pieces in an imperfect system to rely on every month. Not a retail pharmacist, but I just want to share my perspective. I have ADHD, and I've been treating it for about 15 years since I've been diagnosed. As a long-term coping mechanism for my ADHD, I rely heavily on processes and routines. Every Sunday I fill my pill, vitamin organizer for the week, and afterwards I take stock of what I have left. If I have less than 7 pills, I call the doctor on Wednesday and pick it up on Friday. I monitor multiple medications this way, and Friday is my designated pharmacy day. I carefully build buffers into each step of the schedule to account for unexpected delays, ordering the med, and getting it filled without having to bug anyone about it. If I had to switch to 29 or 30 days, that would make the fills fall on different days each month, and make it a much more active process that would require a greater degree of coordination with consideration to my schedule and weekends, and it would turn a previously well-managed part of my life into another stressor. It might be hard to understand to people without ADHD, but the routines and careful planning are my healthy coping mechanism. In any event, if you are following carefully, you'll note that I don't build an excessive supply at any point. My fill dates end up looking like this: days 28, 28, 28, 28, 35. I'm fortunate that my own pharmacy is comfortable with this and has never even asked. I'm assuming my pills days ratio is fairly evident in my fill history, but I would still be prepared to explain if asked. I'm also guessing that as a polite, put-together professional I might be getting more leeway than some others, so I just rambled on for a bit, but I guess my point is that it's not always as malignant as it seems. People with ADHD can struggle with planning, and it's not always ill-intentioned. In my previous role, we load 2 days early, which is reasonable. People have jobs, travel, childcare issues, transportation issues, etc. The issue I had when I took over my store was we had individuals who thought that meant they could pick up on day 28, 30th every month. I shut that down and we moved to a rolling 90-day model. In my current state, they only allow X amount of days early for the life of the therapy, so early fills aren't so much a thing with patients here. That being said, I am fine with patients calling a few days before due to make sure we actually have stock on the due date. In my retail store, we count the pickup day as day 1 and the next fill date is day 30. We are closed Sundays, so we'll fill day 29 if their fill day is on a Sunday. Every month, the same customers call 1-2 days ahead, so we started marking the label with the next fill date. Also, the month of March is always a challenge because customers always forget about 28-day February. My doctor at the VA won't refill until day 29. Then on day 30, the mailman leaves a note in my mailbox saying I need to sign for it and not even attempt to knock on my door and physically get my signature. Then I have to fight with the post office for a week for them to redeliver the meds. So for 5-6 days, I'm going through withdrawals feeling like shit. I complain every month and nothing changes. If it's as needed and you're picking up the earliest possible, that's not healthy nor appropriate. If I keep seeing early fill behaviors every time I see the DUR list, I get very annoyed and irritated, especially when they are calling for them as well. Although I don't have their soap notes, sometime I wonder if I'm truly helping them. I've seen 2 sides where they are high out of their mind, and the other those that are young and healthy picking up oxycodone 15 milligrams like another Tuesday. If it's not as needed, I go by what the system allows. Again, no right and wrong. What I do, however, if anyone argues with me or my staff using their text, phone regarding the due date with their control medication and is as needed, I push that tomorrow or have the office call me. At some point, you have to correct those behaviors and can't let them walk over you. Day 30 as much as possible. Things happen and I may be lenient here and there and fill a few days early, but I will let them know then and there that the next fill will account for 30-day supply plus however many extra days early I'm giving now. For example, if it's day 27, the next fill will be 33 days after this pickup date. So no matter what, it will always end up being every 30 days in the grand scheme of things. We aren't open on the weekends, so my pharmacist will fill the script on a Friday if it's due on a Saturday. Sundays get filled Monday. He will make a notation on the script and fax the prescriber to let them know what he did. The docs generally will adjust the fill by date's next set of fills. Generally, if they're a good patient, then the 28-day mark is fine. You all know what the good means. If assholes or try to get their stuff early, often then 30-day mark it is. General rule, I will fill on 28 days on a 30-day supply. If a patient needs it earlier due to a vacation, a lost prescription, etc., I document a discussion with their provider. Overall, however, I want my patients who are trying to take their meds responsibly to have a window to cover normal day-to-day life. Letting people build up a week of leeway is completely fine. However, this does not mean I blindly fill on day 28 looking only at the previous month. When I see someone has filled early 2 times in a row, I talk to them about their usage. If I see a pattern of early refills, we need to take that discussion to their provider as well. If they are evasive, or tell me they are taking the med exactly as prescribed but are somehow out of meds by day 28 after a couple previous 2-day early fills, that's a big red flag. The discussion with the patient and the provider needs to include what my expectation is for future fills, and what harms could come from misuse of their medication.